Now I'm going to invite Dr. Stephen Abramson to the podium. Dr. Abramson is our Vice Dean for Education, Faculty, and Academic Affairs at NYU. And he's a leader and innovator in education reform, and he's co-principal investigator with me on the Macy-funded consortium grant. Steve.
Thank you, Joan. And I want to add my welcome to everyone who's here today, because it's a remarkable assemblage of leaders in education from around the country and also internationally. You should know also we're web streaming this internationally for anyone who's interested. So anything you say should be profound and meaningful to the groups who's listening. You know, we began, this is our 4th annual Innovations in Medical Education Symposium. We began around 2013 when we were launching our 3-year pathway, and we had a wonderful discussion and debate among deans that were there, associate deans and program directors, and we published this finding recently. We then formed, through the support of the Macy Foundation, a consortium of programs that have 3-year medical accelerated pathways, beginning with some of the founding schools like Texas Tech and Mercer, and then adding others that have come along, including a 3-year branch campus in Medical College of Wisconsin in Green Bay. And we have spent the last 3 years meeting, looking at the challenges of acceleration and what lessons we learn about how to improve the learnings of these kids who are coming in for 3 years of medicine. And one of the lessons when you accelerate is that becoming a doctor, as everyone in this audience knows, is not a 4-year or 3-year medical degree followed by a 4 or 5-year residency program. You become a doctor over 6, 7, 8 years. And so therefore, what our system is missing is this continuum, this notion of a continuum. Now, when you have a 3-year program that accepts your own students to your residency programs, you therefore have an ability to track these kids, to socialize them when they're in their medical school years by associations with their sponsoring departments, and then to track them, both their learnings and their education, as they become residents. That's an advantage of 3 years. One of the disadvantages, as Bob Grossman said, is that right now, most of them, there are exceptions, will stay at the program of their sponsoring medical school. We believe as competencies are more clearly defined and the acceptance of the competencies of 3-year graduates is evident, which is becoming evident, then other schools will begin to accept graduates of 3-year programs. But the learning was moving away from whether it's a 3-year or 4-year program. We have this system in this country where you basically go to medical school and then you start all over again in your residency program. If you're at your own institution, there's some continuity, but often we leave, we go to another place, and we start our residency programs. Now, what's changing in the country, and we're really fortunate to have leaders of the various national associations here to talk about this, is that we are talking about competencies and trustable professional activities for medical students, milestones for GME. And so there's opportunity now to begin linkages between becoming a physician as a medical student, that is through EPAs, and continue your training in your graduation, in your residency programs. The challenge, as we all know, is that medical school reform is relatively easy. Most of us do it every 7 years just prior to the LCME visit. You have 150 captured students or whatever, and you make wise decisions about your curriculum. Changing GME is much harder because there may be 30 different programs, and becoming a plastic surgeon is very different from becoming a pediatrician or an internist. So there are, by necessity, divergences of skills that are needed when you leave medical school. So one needs to identify those things that should be continuous, that should be important whether you're a resident in orthopedic surgery or dermatology. A lot of that now is being defined at the institutional level. Right, so from the AC-GME we have CLEAR, and CLEAR is supposed to align with institutional initiatives in quality, safety, et cetera. Institutions are then moving more towards quality, safety, the intellectual areas of value-based medicine and clinical decision-making. All of that, frankly, seems to be disconnected from medical school education. We don't teach VBM, we don't teach CLEAR, for example. And these are the threads that I think one needs to begin to focus on as you train physicians, regardless of their residency specialty training. So I think we're really excited today to take those things that relate to UME and assessment, and how do we begin to attach them through a continuum, not just for students who stay with us in our programs, to go to others, and how do we put in place assessments and tracking of educational milestones across this divide of UME and GME. So it's a big challenge because of the reasons that we all know. To get GME programs to begin to think collectively about certain specific objectives. But I think what's very striking about today and very exciting is that this is a day to exchange ideas. It shouldn't be the last day that these things are discussed. We have wonderful expertise in the audience. The notion is to begin together to grapple with these continuum issues, and then ultimately continue these discussions as we go forward, particularly working with accrediting agencies that will work with us to define these transitions of learnings. So with that, I'll stop. Those are basically the features of today that we're trying to accomplish, and I'll turn it back to Joan.